Good afternoon. My name is Horecki Lopez. I'm a second-year medical student from the Medical College of Wisconsin and excited to be here to present this project today. So my project, as was stated, is titled Primary Care Providers' Attitudes and Knowledge of Bariatric Surgery. To start with, neither I nor my co-authors have any disclosures that are relevant to this presentation today. However, all disclosures are listed on this slide for completeness. I'd like to start by speaking a little bit about the background behind this project. Currently, 24 million Americans are classified as severely or morbidly obese with a BMI of greater than 40. However, in the year 2016, only 216,000 bariatric surgeries were actually performed. Suggested explanations between this disparity between the number of potentially eligible surgical candidates and the number of actual procedures performed has been postulated to include such things as referral barriers at primary care provider visits. With this in mind, this study aimed to understand the referral and practice patterns of primary care providers regarding the care of patients with obesity. In regards to the methods behind the study, this was a survey project in which an anonymous 39-question survey was both designed and distributed electronically using Qualtrics survey software. The survey was distributed to primary care providers, which included both family medicine providers as well as internal medicine providers, at a single academic institution with community physicians. Questions within the survey explored such things as provider demographics, the referral patterns for weight loss management, providers' knowledge of pathophysiologic mechanisms of obesity, as well as their knowledge of bariatric surgery qualifications. Of the 121 surveys originally distributed to providers, 41 responded for a response rate of 33.9%. Of those respondents, the majority were female and between the ages of 35 and 44 years old. Additionally, providers were asked within the survey to provide their height and weight from which a BMI was calculated. 63.4% of providers had a healthy BMI between 18.5 and 24.99. Further questions looked at the specialty that these providers were currently practicing in. 51.2% identified as primary care physicians, 39% as internal medicine physicians, and approximately 10% identified as advanced practice providers. We also asked providers within the survey whether they had referred at least one patient in the past 12 months to a bariatric surgeon, denoting them as a referring provider. 75.6% of respondents indicated that they had referred at least one patient. Furthermore, we asked providers whether they had at least one patient in their patient panel who had previously undergone bariatric surgery. Of note, 100% of respondents indicated that they had at least one patient who had previously undergone this procedure. Additionally, 84% of survey respondents indicated that greater than 15% of the patients that they had seen in the past 12 months would be considered overweight or obese. When we looked at this distributed by primary care provider age, we found that older providers aged 45 to 64 were significantly more likely to state that they had greater than 15% of their patients classified as overweight when compared with younger providers aged 25 to 44. Questions in the survey also looked at weight loss conversations that are happening between primary care providers and their patients. Of note, 51.2% of providers reported initiating conversations about surgical weight loss greater than 50% of the time. This means that in many cases, these conversations are either being initiated by patients themselves or just not being initiated at all. Furthermore, we found that male primary care providers were significantly more likely to state that they initiated conversations greater than 50% of the time when compared to female primary care providers. Furthermore, referring providers, those that had referred at least one patient in the past 12 months, were significantly more likely to state that they felt comfortable broaching the topic of weight loss surgery when compared to non-referring providers. The survey also looked at perceived barriers that providers felt existed, not only to discussing weight loss surgery, but also to actually referring patients to a bariatric surgery department. Top barriers that providers identified to discussing weight loss surgery included being unsure if a patient's insurance would cover the procedure, as well as being unsure whether a patient would even qualify for the procedure. Perceived barriers that were identified to actually referring patients to a bariatric surgery included a perceived lack of patient interest or engagement in obesity management, as well as time restrictions on office visits. One question that was asked within the survey asked, if you feel a patient meets surgical weight loss criteria, how often do you refer a patient to a bariatric surgeon? Of note, almost 30% of respondents said that even if they felt a patient met surgical weight loss criteria, they would rarely or never refer that patient to a bariatric surgeon. Questions also looked at the weight loss management strategies that providers employed with their patients. We found that referring providers were significantly more likely to state that they frequently or almost always recommended exercise as a form of weight loss management. Analysis was also done based on provider BMI. We found that providers with a BMI of greater than 25 were significantly more likely to state that they frequently or almost always recommended medications as a form of weight loss management when compared with providers with a normal BMI. Providers with a normal BMI were also more likely to agree with the statement that obesity treatment is primarily the responsibility of specialists than those with a BMI of greater than or equal to 25. This slide has some general information about provider knowledge and beliefs that was garnered from the survey. We found that 73.2% of providers indicated that they were somewhat or very confident in knowing the qualifications of bariatric surgery. 56.1% indicated that they were somewhat or very uncomfortable addressing complications from bariatric surgery. About 1 in 2 correctly identified the mortality of Roux-en-Y gastric bypass, while about 1 in 3 providers correctly identified the percentage of excess weight loss following laparoscopic sleeve gastrectomy. Finally, 43.9% of respondents felt that the risks of surgery actually outweighed the benefits of the procedure. At the end of the survey, we did ask providers whether they would be interested in receiving patient-targeted handouts to guide the discussion on obesity management. 88% of providers indicated this was something that they would be interested in. In conclusion, the results of this study show that few providers report initiating a discussion on surgical weight loss with potentially eligible candidates. Furthermore, the barriers identified within the survey not only offer an opportunity for improved education on the patient qualifications as well as complication management from bariatric surgery, but also an opportunity to provide providers with strategies for streamlining conversations and referrals, as well as the reinforcement of safety of surgical weight loss. Finally, the fact that 88% of providers indicated they would be interested in receiving patient-targeted handouts does indicate a strong desire from providers, not only for continuing education, but also resources to guide weight loss management conversations. Thank you. I'll be happy to take any questions.
Great.